The ICF Training and Technical Assistance Team is honored to welcome you to this California Housing and Community Development Training Session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services Contract. I'm Chris Pitcher from ICF. I'll be hosting today's session. Today's session is part of our community workshop series and is focused on housing-focused case management overview. This is a series, so we're going to have more than one session on looking at housing-focused case management. Today is our first. It is my privilege to hand it over to today's first presenter, and that would be Erica Snyder. Erica, please go ahead.
Thanks, everyone. Welcome and good morning. I know it wouldn't be a Zoom meeting if I didn't accidentally do that. We're really looking forward to talking to all of you today. I'm going to let each presenter briefly introduce themselves as they talk, but this is your cast of characters who are coming to you live about case management today. I'm Erica Snyder. I'm a subcontractor with ICF, and I'm located in Carlsbad, California, just outside San Diego. But before we dive into the actual content, we'd love to get a sense of who's actually in the room. This just helps us to know who we're talking to, if there are certain things that we should be highlighting. And so, Taylor, if you wouldn't mind throwing that first poll up, and if you all, as you're in here, just pick whichever answer feels the most right to you. If there's that option for other, feel free to write that out in the chat, like if none of these fit who you are. I'm not seeing the poll on my end. Are others seeing the poll? Maybe
I've lost the ability to launch the polls. If one of my co-hosts can grab that.
Did I do it? There we go. The poll should be up. Thanks for bearing with us. Zoom hasn't had its coffee yet today, so appreciate y'all being flexible. I'm seeing some different results coming in. It looks like we got a lot of folks who are rapid rehousing case managers, which is great. This should be a lot of folks may have a foundation, and so we'll be operating from the same foundation by the end of this, as well as going a bit deeper in subsequent sessions. Also have a few folks who identify as shelter team members or a supervisor. And then I see the other, so if you identified as other, please throw that in the chat. Let's see if I can multitask and do all of the things. I probably can't, so I'm just going to end the poll, but appreciate y'all taking a minute to do that. So you should see the results as I saw them here in front of you. And then we've got one more poll for folks today. And I will go to that next slide. This next question is just getting a sense of your background. And again, no right answer. Share what you would like to, or you can do a different type of counselor, or maybe none of these apply to you and you're like, I'm none of these things on XYZ. Throw that in the chat too. These were just a short list brainstormed options that we came up with. We'd love to hear from you all, what sort of expertise you're coming to or thought background that you're coming into the room with. All right, folks are still, the numbers are moving, so I'll give it just a moment. All right, the numbers stop moving, so I'm going to share those results. We've got a variety of folks. A lot of folks have experience in the field of working on helping to get our unhoused neighbors housed, which is wonderful. We've got some folks who identify as social worker, and of course, some people with lived experience of being homeless. So thank you all for being in the room today. Some other types of counselors as well. And again, use that chat feature. We're going to do talking, but this is really meant also to hear from all of you and have dialogue back and forth. So with that, let me hand it over to Ashley.
Thanks so much, Erica. Really appreciate it, and so glad to be here today, everyone. I'm going to take a moment and just talk about really the explanation about this series. This is a three-part series. So as we're thinking about housing-focused case management, really from crisis intervention to the stabilization aspect of housing, we're really thinking about three different intervention stages. The first one is helping the participant find housing, right? So the person is in an immediate crisis. They need to find housing. The second stage is assisting the participant in stabilizing within that housing, probably a rental apartment, something along those lines. And then the third is really supporting that participant as they retain that housing. So thinking about housing retention. So we're using these intervention stages to guide the series. And today's session is really a primer on case management and an overview of the concepts that we will dig into deeper during the second and third sessions. The second session which is scheduled for October 20th, is really going to focus on that crisis intervention and management. As someone is in an immediate crisis, what are we doing? What kind of supports are we offering to help address that particular crisis, right? The crisis of no housing. The third session, which is going to be on November 3rd, is really looking at what kind of supports that we are offering case management wise as it comes to housing stabilization and housing retention. So each of these sessions builds upon the previous one, and we really hope that you plan to join us for all three sessions. Let's go over the agenda for today. As I mentioned on the previous slide, we're really going to talk today about the roots of homelessness, the impact of homelessness on the individual, case management and its core functions, an overview of the approaches of housing-focused case management, and then we're going to finish up with some slides about self-care. So throughout the session today, we really want you to feel free to write or ask any question in the chat. We will do our best to answer the questions as they come in to the best of our ability. So let's talk a little bit about what is housing-focused case management. You're also going to see it referred to as HFCM throughout this presentation and the next couple of presentations. But what it is individualized support that helps a participant quickly resolve a housing crisis. So that is either literal homelessness or imminent at risk of homelessness. And doing that by assisting them to obtain or remain in safe and stable housing, and then have that person and help that person connect to both services and supports that they need and desire. I want to put a real emphasis on what they desire as well with regard to support and need to help them remain stably housed. So that is the work that we are really talking about when we talk about housing-focused case management. So again, let's just dig a little bit deeper and talk about why we are emphasizing the housing piece here, right? It's because homelessness is a lack of a stable place to live, but there are so many different variables that impact and influence homelessness. And we're just going to talk a few minutes about each of those. We know that this includes the lack of affordable housing, unemployment or underemployment, the lack of sufficient social supports, health conditions, interpersonal violence, and then those structural barriers of racism and inequity. And again, I'm going to take a moment to dive deeper into each one of those. But low-income households who are typically unemployed or underemployed due to a number of factors, including a challenging labor market, limited education, a gap in work history, criminal records, unreliable transportation or unstable housing, and poor health or a disability. So when people who are low income but employed, those wages have been stagnant and really haven't risen and kept pace with those expensive housing costs that we are seeing across the country and have been seeing as an ongoing trend in our country. The typical American worker has seen like no growth or very little growth in weekly wages over the past 3 decades. And many of those who experience homelessness are unable to work due to a disability or who are not able to quickly earn the money they need for rent. So we know that about 8 million extremely low-income households, those are folks who are at the very low end of the area median income or the area average income, have to pay at least half of their income towards housing, which means they are housing cost burden, and that puts them at risk of housing instability and homelessness. There are also a number of structural issues that keep lower income housing or households, in that income bracket. This is limits on or steep requirements to keep public benefits, and it is really hard to build wealth and move out of poverty in our country. I want to talk a moment about health conditions. So an acute physical or behavioral health crisis or any long-term disability condition can lead to homelessness, and homelessness itself can worsen chronic medical conditions. According to HUD, right, the Department of Housing and Urban Development, most of the individuals that are living in shelters are more than twice as likely to have a disability compared to the general population. I also want to touch on the issue of opioid abuse that has really risen to the level of a national crisis, along with just the issues of not only substance abuse disorder, but unfortunately overdose deaths. And those have really tripled since the year 2000. We know that the epidemic is notable for affecting people from any race, gender, socioeconomic status, but its effects are felt really in unique and notably harmful ways by people experiencing homelessness. Substance use disorders are known risk factors for homelessness, and substance abuse and overdose disproportionately impact people who are experiencing homelessness. We also know that treatment and preventive care can be difficult to access for people who are experiencing homelessness. This is either because they lack insurance, have difficulty engaging with healthcare providers in the community, can't access them, and don't feel comfortable going to them, or because they live in communities where harm reduction and other alternative treatment modalities are not covered by insurance or frankly disallowed by state statute in some of the more conservative parts of our country. Let's talk a moment about interpersonal violence. Domestic and sexual violence experience is common among youth, single adults, and families who become homeless. And for many, it's the immediate cause of their homelessness. Survivors of domestic violence may turn to homeless service providers to seek a safe temporary place to stay after fleeing an abusive relationship. And others may turn to the homeless services programs primarily because they lack the economic resources to secure or maintain housing after leaving an abusive relationship. And then let's dig a little bit deeper, and I'm going to turn it over in a moment to my colleague Maite, who's going to talk some more about the historical and structural barriers in our country. But we know that most minoritized groups, especially African Americans and Indigenous people, experience homelessness at much higher rates than white people. And this is largely due to the long-standing historical and structural racism that exists. The most striking disparity can be found among African Americans, who represent 13% of the general population, but account for 40% of people who are experiencing homelessness and more than 50% of families who are experiencing homelessness. And this imbalance has absolutely not improved over time. We know that minoritized people have been systemically denied rights and socioeconomic opportunities. All minoritized groups, including Indigenous and Latinx populations, share these very similar histories with our African American population. And the disproportionality in homelessness is a byproduct of this systemic inequity. The lingering effects of racism continue to perpetuate disparities in critical areas that impact rates of homelessness. So I'm going to turn it over to my colleague Maite, who's going to dive a little bit deeper into this particular topic, and I look forward to hearing from her. Thanks so much.
Thank you so much, Ashley. I don't know if you all saw in the slide before, but there was a question about what comes to mind for you all when you think about the systemic inequities that Ashley mentioned and homelessness or lack of housing. So just invite you to think about what connections come to mind for you and type them in the chat if you'd like, just so that we have more time at the end to have a further discussion. But before I go any further, I am Maite Antilla Vando. Nice to see you all and meet you all. I am a Racial Equity Partners Associate and Consultant working alongside ICF. And so my task today is just to do a little bit of a historical background, not too much because I know you all have access to trainings that we have done as REP and ICF on the historical context of racism, but I did want to sort of center us in that just a little bit as we dive into the root causes of homelessness and what the best approaches might be to address them. So what you see on the slide is a snapshot of the historical sort of timing of American slavery, of enslavement and segregation, which obviously is affecting more, is talking about African Americans or Africans being enslaved and brought into the United States and other countries, of course, not just in the United States. And so the reason that we're showing this slide to you is just to give us sort of the reality check of how long ago this started and where we are now. The other thing I want to point out is you'll see in red, it says American slavery, and then yellow, we start going into segregation and sort of Jim Crow eras in the 1950s to now, and one could talk about the new Jim Crow laws, which is connected to a book that I recommend if you all want to read, The New Jim Crow. And I just wanted to highlight that the green doesn't mean that we're out of trouble, let's say. It doesn't mean that everything is fine. It simply is the way that the slide was created and we weren't able to change the colors. But it's just really setting the stage for discussions around where we are now, where it comes from, and that it's really just not that long ago. So if we can go to the next slide. What you see here, again, thinking about a timeline of history of racism, these are images from the 1920s and the 1940s into 60s that just highlight the fact that in housing specifically, there have been covenants, housing covenants, policies, sort of rules that people were meant to follow that were just perpetuating inequity and perpetuating racist policies. One of the images that you see here is, quote, "We want white tenants in our white community," right? So again, making this point that white is good, that white is better, and that anything that is not white is basically not. And as Ashley said, with the impact being seen the most in the communities of Black Americans and Indigenous peoples. So if we'll go to the next slide. And then I think actually one of you, thank you for answering the question about what comes to mind. I think one of you already said this in the chat. Redlining is one of these examples of historical racist policies. So just to frame us in what that really means. So the federal government under the Federal Housing Administration Act created policies with mortgage underwriters and banks, basically to create what they called red line maps, literally marking red line sort of tenants versus green line tenants. And so what that meant was that green was best, again, as I said before, just like thinking about white as being better. Green is best, which meant supporting folks with low interest rates to get into the housing market, which again benefited all white people. City zoning ordinances shared this with white people, and then basically allowing for white wealth to be built, versus tenants that were seen as red line tenants or tenants that should not be trusted, should not be given loans, should not be given any sort of support in order to find housing. Interestingly, I will also note that historically speaking, when veterans were coming back from the war, at one point they were also given support in obtaining housing, but even though that was the case, because of the inequities and the entrenched racist policies, they still weren't able to benefit in the same way as their white counterparts. And so again, this entrenched segregation created economic circumstances in which white folks could get into the housing market when it was inexpensive and start to build wealth over time. And so this led to a racial wealth gap currently, as far as I can tell, that is 10-1 in terms of white people to people of color, and it leaves almost no economic buffer, which again, Ashley sort of touched on this idea that it is, I think she said, it's very hard for people to come out of poverty in our country. I would second that. And I think, again, specifically to say here that historically this has impacted people of color much more than white people. And again, within the group of people of color, most impacted are Black, Indigenous, and Latinx people, sort of in that order. And then if you'll go to the next slide. Again, just to ground us in a little bit more statistics, African Americans today are disproportionately homeless at a rate of 3-1 compared to the general population, which is a staggering statistic. Native Americans, 8-1, that's the ratio there. And in Latinx communities, what's sort of a unique challenge is that they are currently undercounted. And I just want to highlight there that in this population, the policies and the racist policies that impact them have to do with legal documentation in order to be in this country. So you have mixed status families in terms of status of citizenship and status of legality, as they say, in whether or not they're able to stay in this country and access benefits. And so unfortunately, part of the reason from my perspective and my experience is that Latinx populations are difficult to count in terms of homelessness has to do with the concern about deportation and other legal issues around citizenship status. So again, just highlighting for everybody that the root causes of homelessness are not individual in nature necessarily, that they are truly basically a result of a systemic inequity, systemic issues that impact people of color in a disproportionate way in comparison to white folks. So with that, let's talk a little bit more about this. So this is just, again, a set of definitions to help, let's say, demystify definitions of racism. So we have structural racism, so compounding effects of multiple factors, which I just mentioned, historical policies, etc. I will say that while these policies, or I mentioned Jim Crow laws prior, while these policies, the historical ones that we might be familiar with, are no longer in place, unfortunately, there are still exclusionary policies that exist. I will say, as a person that was a former director of clinical services in a homelessness agency in Boston, unfortunately, there were situations where communities, if they were not basically in agreement for homelessness shelters to be created in certain neighborhoods, that was often connected to, again, I would say, veiled racism. There is also institutional racism, the inequities in our organizations. So that's what the institutional part means. So within the organizations where we might work, or organizations that we might partner with or work with or be around, there are unfortunately still unfair practices and inequities present. And so it's on us to look out for those and make changes as best we can. And then there is interpersonal racism, which, again, we've unfortunately seen many examples of this. And what this is when one person targets another based on prejudice or negative bias and actively infringes on their rights. One thing that is not listed here that I just want to mention, which I think is important, as I said, we are, all of us that are here today, we are part of systems, we are part of organizations, and it is on us to use our privilege, if we have them, privileges, power, expertise, and knowledge to make changes to these systemic inequities and injustices. And actually part of that is connected to how we approach the work that we do, which is what we're doing here today, right? We're talking to you today about what are the best approaches that are both equitable and client-centered in nature, so that we can address the issues of homelessness and really support people to reach, to access their rights as they should be able to do. So with that, I will let Ashley go.
Actually, I think Mayte, I'm going to pick it up.
I'm so sorry, Tom, go ahead.
Totally fine. This is a team effort today, and I just want to thank everyone for joining us. And I really appreciated what Mayte just walked through for us. I realize, as she said, at a very high level, very quick overview, there are other trainings that we've produced and lots of other content out there, some great books, as Leslie noted in the chat, and other resources. We really encourage you to look at. Let me just quickly say who I am. I'm Tom Albanese. I'm a team member with ICF, consultant working with the ICF team in California, provide training and technical support to you all and the many other providers around the state that ICF is supporting on behalf of HCD. I'm based in Columbus, Ohio, and I am a 30-year, as of May this year, 30-year licensed social worker. Started my career in rural community in Ohio, working with families and individuals who were facing homelessness as a caseworker and a shelter director, wearing multiple hats, and eventually found my way to Columbus and then doing a lot of national work in the last couple decades. So I've been around the block, and one of the things I want to just bring us back to, as far as what we're talking about today, and I really want to maybe put a double underline under what Mayte just walked through with us, as far as context. Why do we care? Why is it important that we understand historical and systemic racism and other forms of bias? We care, and it matters because in our work, serving people who are fundamentally facing a crisis and disparity of resources, and in our role as case managers of various types, whether you're sitting in a shelter or in a rehousing program or in any other setting in homeless services, by definition, you hold power that the person you're serving does not have. And there's a power dynamic inherent in your role. Whether you kind of feel that or sort of see it, or it doesn't feel that way, but it's there. even as much as we work to shift those dynamics, it is inherently there because the person in front of you is trying to access a resource or a support or needs something that you have, right? So you have power. That's really important. I've, as I said, been around a while. I've seen even the best social workers with the best intentions misuse that authority and power without intent to harm, but with the effect of harm. So we're going to talk about that. We're going to pivot into case management, kind of bring it back to the work that we're doing, the principles and approaches that undergird our work, and really the housing focused nature of case management in the context of the history and the trappings and the racism that's sort of inherent in a lot of our structures, including our homeless systems and programs. So we're going to bring it back to that and keep that background front and center as we go through this. So, but let's talk about case management. Ashley talked briefly earlier about what is housing focused case management. Let's just dial it out a little bit more for a moment and talk about what is our role as case managers, whether you're in child welfare, or you're in homeless services, or you're working in a hospital setting. In the field of social work, case management is a very defined thing. You know, the National Association of Social Workers has a very defined model of case management. And essentially it's this: it's a process to plan for, seek, advocate for, and monitor services from different social services or healthcare organizations and staff on behalf of a participant or a person in need of support, right? Our primary goal is to enhance and improve that person's functioning and capacity and their well-being by helping them access services, by providing those high quality services, by being efficient and effective, thoughtful, and intentional about the services and supports that we're offering, to make sure that they're as aligned to that individual's needs, and as Ashley said earlier, their desires and preferences as possible. So we're building individual agency, and we're empowering the individuals or families we're working with to take charge of their lives. And you'll see in a moment why this is so important in our work, that we center our work on empowerment and sort of bringing people to their fullest abilities in the moment. There are some guiding principles behind social work I just want to sort of reflect on for a moment. You know, it's not, I'm sure most of us don't pull out the National Association of Social Work manual every day and kind of read this stuff. We as a team and putting together this training, you know, we all refreshed on this. It was very good. I've been doing this a long time, as I said, but it was good to refresh on, you know, ethics and so very fundamental principles of social work, and specifically social work case management. And there's three principles we just really want to lift up. One is strengthening the developmental, problem solving, and coping capacities of the client. This is a principle of our work, is that empowerment and those elements of it. Enhancing a client's ability to interact with and participate in their communities, helping them learn how to navigate and use resources as they choose and desire and are able with the support they're asking for, and consistent with their values and their goals. And then finally, linking people with systems that provide them with resources and services and opportunities on an ongoing basis, right? So this is really central to our work. We wanted to make sure we touched on that. Go to the next slide. We want to talk more specifically about housing-focused case management and some of the core functions of that. And I want to start by just emphasizing that, again, this is very much like how we do case management in any type of service, Mylu, but when we're talking about housing-focused case management, there are some very particular things that we need to focus on and account for in our screening and assessment approaches, in our case planning approaches, and in the services we provide. We're going to touch on those today. We're going to dive deep into those in the next two sessions, all right? So this is just a quick survey, and then we're going to go deeper. But first, I want to emphasize the importance of engagement. No matter, again, where we're providing our support for somebody, having that rapport and having trust and an ability to share openly with a family or individual you're working with, that warmth, that caring, that empathy it's okay to be human in our work, right? And to be engaging and to show fallacy and to show empathy and all that regard for that individual's immediate situation. And in fact, I would say it is our obligation to provide that rapport building and engagement. In fact, we can't really do our work well if we don't have good rapport, if we don't have that trust, right? So I'm probably preaching to the choir here. But as Ashley said, this is our primer, right? We're kind of making sure we're all starting with the same understanding. So we want to make sure that engagement is really front. We're constantly building engagement. Every time we meet with somebody is an opportunity to build that rapport and trust, right? This is central to our relationship. But let's talk about the core functions. Intake, that's really not much different than any other type of programmatic intake. When you're thinking about housing-focused case management, the intake isn't necessarily different. The things where I start seeing some differences really come into focus when we talk about screening and assessment. And this is really important. I just want to say, if you're a shelter case manager or you're a rapid rehousing case manager or you're a street outreach case manager, or wherever you sit in your community system, if you're providing housing-focused case management, you need to have a very particular set of knowledge and awareness to be able to kind of detect and investigate with somebody their housing history and their current housing needs and the resources and supports they may have available to them that are not maybe immediately apparent to them, right? So when we're doing screening and assessment, this is actually not some rote thing we're doing. We're actually doing this with a purpose in mind. The purpose is to, first and foremost, not exclusively, but to understand that housing related history, those housing related needs, what were the triggers, the triggering events, the instances or the factors that contributed to housing instability in the past. That's probably a good indicator of potential housing flags in the future. What resources are available to somebody currently or potentially, what might they qualify for, and what are their preferences in terms of their housing needs, location, amenities, and so forth and so on. That's what screening and assessment centers around. Again, it's not exclusive, and we'll talk about this in the next session, where we also want to make sure we're screening on other critical urgent needs as we're focusing on the housing emergency that we're centering on. We also want to make sure we're doing some initial screening for other needs. And there's an important principle there we'll come back to in the next session around making sure we're not over assessing somebody. We're not asking questions that are tangential or unnecessary or perhaps just irrelevant to our work. So housing plans then should feed off of the housing focused assessment we've done, right, with a participant. If we're talking about somebody who is currently, let's say, sitting in a shelter and they've just got settled in, they're now starting to focus on their housing search, and you're the case manager supporting them, making sure their case plan, of course, is centered around that housing search and the steps that are needed and the things you're going to do with and for and in support of that person or family should be articulated in that housing plan. The goal being to resolve that housing crisis as quickly as possible and to make sure other critical urgent needs are being addressed as they need to be addressed simultaneously. Otherwise, again, we're staying sort of centered around housing. And again, we'll get into that. Housing assistance, service linkages, and coordination is really about making sure that clients have the means to stabilize in housing and retain it ongoing, right? Ashley touched on this earlier about the stabilization and retention supports look different than the supports we're providing to somebody while they're still in sort of the housing search mode. And those stabilization supports really focus on not just making sure somebody's sort of understanding their lease and making sure they're getting settled in with the the apartment necessities they might have to purchase or whatever to get the utilities turned on. We also want to make sure they're getting connected to other community resources as quickly as possible. The goal being to limit the amount of time we have to continue to stabilize somebody and move out of their lives as quickly as possible so they can move back to a normal state of living. We are crisis responders in that regard. Housing focused case management typically is time limited unless you're doing permanent supportive housing. So our goal should be working towards case closure and transition. And this really begins with the very first time we're talking with somebody. We talk about what their goals are, where, you know, we can help them resolve this crisis immediately. Where might they be? Where might they want to live? Like, we're focusing on moving out of that crisis and out of our program as soon as we're able to start having those conversations and putting those goals out there and giving us some direction. So we want to talk about case closure, and we specifically want to focus on case closure that is guided. Those decisions around case closure and transition are guided by whether somebody is currently stable in their housing, compliant with their lease, they have the financial means to pay for rent in the near term, their utilities are on and not in arrears, and there's other key indicators are met suggesting that the housing crisis is resolved, even if there are other needs that household has. And that's a good indication that it may be time to start to exit a client. We're going to talk about that in a housing focused case management approach. How do you start that exit planning, that discharge planning, if we like to call it that, from day one? And so we will move into that again later in the series. Go to the next slide. Just very quickly, you know, as we talk about at a high level, you know, what do housing focused case managers do? What do you all do, right? You all do this every day, or most of you do this. Some of you are supervisors, of course. What are some of the qualities or skills you think are essential? We identified some of the skills that we think just very, you know, high level, we think are very important to do this work well. Being honest, having empathy, being an active listener, helping somebody manage their expectations, and then of course being flexible and individualized in your service, and maybe most of all having patience, right? What other skills do you think are important, or have you found really to be critical? Drop those in the chat if you would. We're kind of looking to popcorn these just for a moment. I would just love to hear from the other experts around the table here. Empathy, definitely. Organized, Kristen, I think that's a good one. That's you can't really do this job if you're not well organized, for sure. What else comes to mind for folks? Important skills. Boundaries. That is so good. Other skills that come to mind? Let me say something about building a relationship. Patience, active listening. Relatability. Excellent listener. Those are great. You know, I want to pick up, keep dropping those in the chat. I'm watching those on the boundary question super quick, because we didn't really touch on this, although we will go into this. We really need to emphasize the need to focus on good boundaries. Like, it's not an obvious skill and it's not an inherent skill. Even the most seasoned case managers, you know, might have boundary issues, particularly as we're doing this work in people's homes. You know, if you're a Rapid Housing case manager, you most likely are providing some amount of home-based services, or you will as we transition further out of this pandemic. You know, to really help somebody get stable in housing, that in vivo kind of experience can be critical, right? That's where boundaries are so critical as well. So I'm just glad you called that out. We don't have to dive into it more, but good point. Compassionate, connection with community resources, culturally sensitive and aware, diverse. Thank you for popcorning that. We just wanted to, we're obviously there, we could probably dive into every one of these qualities in some fashion, but we wanted to make sure we're hearing from everybody today, and the things, share it with your peers here. You know, if there's something that you think your team members should be paying attention to. Communication skills, that probably cannot be under or overstated.
Tom, do you mind if I add one thing as we're
Please,
discussing
Nathan,
this?
please. Yeah, please.
So I just wanted to add, connected to this, what Miriam brought forward around being culturally
Yeah.
aware, diverse in the staffing as much as we can be, and the importance of that. I think the other thing to add to that in terms of policy is that it's important for us when we're providing services to people experiencing homelessness that we are aware of policies that might be impacting our clients. And so when I think about that, again, mentioning people that might have lived in mixed status families, families that have undocumented parents, but children are born in the United States, and what does that mean in terms of access to services and or just how they present in the world. And so I think it is important, in addition to be culturally aware and sensitive, to also make it such that we are aware of policies that could be possibly impacting our clients.
That's a great point. Thanks for calling that out. Maybe flip to the next slide and we can build on that a little bit too. This is, we wanted to make sure, as we're talking about housing focused case managers, which feels like a very general term, right? Like we're practically speaking, what are we talking about? Where does housing focused case management fit in the homeless service delivery system, right? And to Mayte's point, depending on where we sort of sit within the system, you see these check marks are sort of examples of like where you might sit in your system, right? And the role you might play might be sort of focused. You sit in a shelter, you're a shelter case manager, you wrap your housing program. So you're kind of mobile, you're sitting over a couple programs, you're working with people in different environments. Maybe you're a street outreach provider, exclusively working with folks who are unsheltered. No matter where you're working. And I didn't say this earlier, and I guess we should just lift this up now, and it gets to Mayte's point. There's an aspect of being a case manager and a social worker that is actually rooted in social justice and the obligation as a social worker, licensed or not, right? Just you're in this role. You have a functional duty to be an advocate, and an advocate in all the sense of the word for the people we're serving, right? So to Mayte's point, if we're working with somebody and we're advocating for them on an individual level, we might also see instances where there are policies in place. Either our program has a policy that's arbitrary, capricious, or biased, or just racist. Like, let's just call it what it is sometimes. Or our system has a policy that's arbitrary, biased, capricious, or racist. Or, our broader community has a policy. And so we have an obligation to raise a flag, and if this harming the people we are being paid to serve, we have an obligation to call that out, right? So to Mayte's point, I'm going to give you a very concrete example, and then I would just challenge all of you to find an example in your community or your program or your system that is an example of let's just call it an outdated policy, to be nice. That needs to change because it's harming our clients. It's fundamentally racist, it's biased, it's capricious, or it's just outdated. I would challenge you to find one. And here's a good example. When I worked in Columbus, in the community shelter board system, a managed system here in Columbus, Ohio, just recently, up to a couple of years ago, before coming back to consulting world, right? I was I wore a system hat. When I came back to the Columbus system, one of the very first things we looked at as a team and as a system as a whole were service restrictions from shelter. Why were people getting banned from shelter? What were the reasons? What were the demographics of people getting banned? And why did we have a ban to begin with? What were causing? And what we found was that we had built a whole structure of policies in Columbus that banned people from emergency shelter for reasons like missing curfew 3 times. You were banned from shelter for 30 days. No debate, 30-day ban. Not showing up, after so many days, or exiting to housing with a lease. You would actually be restricted from returning back to shelter. The thinking being that we're trying to manage behavior. The perception was people are exiting to housing, then just returning back to shelter because it's a better deal. So we created policies that restricted people from doing that, which forgot about the person in the middle of that, because what happens is people go back to housing and shit falls apart and the housing doesn't work out or it's not safe. And so we had created a policy that restricted people who had found housing from returning to the most basic form of emergency housing our community provided for an arbitrary period of time because we were trying to drive behavior. And you know what that created? It created a boot. It created a boot on somebody's neck. I'm being really blunt here, guys, because we have an obligation to be honest, to be empathetic, and to be an advocate, okay? So no matter where you sit, keep your client front and center, But remember, like they're dealing with all these other things too that might be a barrier, and we have an obligation to raise a flag. So, all right, I'll get off my soapbox. I'm going to pass it over to Ashley, who's going to take us into some approaches and other considerations.
Thanks so much, Tom, and really appreciate that comment. I did not describe my background earlier, but I am a social worker by training. And so the social justice, the advocacy piece speaks really to my heart and to the work that I've done. Next slide, please. So Tom really went into a nice deep dive about housing focused case management and the different components of it. And I just want to point out that, you know, knowing what our goal here is, right, is to address the immediate crisis, to stabilize and to help somebody, you know, obtain, maintain, and retain housing really helps us focus also on the key performance measures here. So are we doing it? Is the work that we're doing, is it having an impact? What kind of impact is it having, right? We always need to be thinking about how we are evaluating the work that we do so that we are constantly evolving and improving our practices and our policies. So I just want to touch on 3 of the key performance measures that we think about when we're working with housing-focused case management. The first one is to prevent or shorten the length of time that a person experiences homelessness. Right? The whole goal here is to make that as short as possible and to help that person get to a place of stabilization, regardless of what that stabilization looks like, because it's going to look different for everyone. That really goes into the second point here of safe and stable housing. That means different things to different people. We always talk about the participant being the driver, but how are we helping the participant? What are we doing to support the participant to access safe and stable housing? And then lastly, we use this term recidivism. I hate that word. So let's just talk about it as not returning to a housing crisis or to homelessness. But the whole idea here, right, is that the intervention allows for that person to maintain and retain housing so that they do not go back into a situation of crisis where they are housing unstable or unstable, and they go back into a state of homelessness. So, you know, one of the things that we do need to think about when we think about these performance measures is that the vast majority of the interventions that we are having within this homeless response system are short-term and limited. And they really aren't designed to help people become self-sufficient, completely self-sufficient, or really economically stable than they were prior to that housing crisis, right? These are short-lived interventions. And unless you're in a permanent supportive housing project where you're working with people for multiple years at a time, we really need to think about what those performance measures look like with short-term interventions. So one of my colleagues brought up this idea of, you know, an emergency department, right? You go to an emergency department, the doctors and nurses at the emergency department address the crisis that presents. They're not hitting all of those long-term medical conditions, all of those other factors that play into that crisis, but they are addressing the crisis as it exists in order to resolve that particular crisis. So you can think about that analogy as you're thinking about the key performance measures for housing-focused case management, and to make sure that you are evaluating the work that you're doing and to see what kind of impact it does have, which may change over time. So I'm going to talk next about just some core principles of effective housing-focused case management, and I'm going to dive deeper into the strengths-based approach on our next slide. But let's talk about the idea of being strengths-based, let's talk about it being person-centered, and let's talk about it being equitable. So there is really no one right way to case manage. And I just want to put that out there because, like, I talk about this from a social worker lens, but social workers are not the only ones that are engaged in this work, right? As we learned earlier in the poll, there are a variety of experiences that have come to this training session and a variety of experiences that work within the homeless response system. So There's no one right way to case manage. Most of us pick and choose what intervention style we use, really based on the situation. And that's where this flexibility, we talked about those skill sets, that's where the flexibility is key here, so that we as case managers can adapt to different situations and to different really points within the intervention. Also, no one is expected to necessarily be an expert in an intervention type, but case managers can use clinically informed approaches without being a clinician. The case manager bears the responsibility of being clinically informed, but this doesn't mean that someone has to be credentialed necessarily. So I just want to point those two things out as we really work through housing-focused case management. So let's dive into the strengths-based, the person-centered, and the equitable part. Every participant that we work with has skills and strengths that they bring to the table. So rather than focusing on the pathology, the social work, or really the case manager in general, elicits, supports, and builds on the resilience and potential for growth and development inherent in each individual. Participant strengths and assets may be intrapersonal, right, found within the environment or developed in response to the environment, but using the participant's strengths and skills really helps increase their control and builds upon their existing resiliency, which can really help reframe and refocus case management efforts. So I like to think about using this question: what strengths does the individual bring, and how can we build upon those to support this person as they resolve their housing crisis and become housing stable? Case management and effective interventions are not about systems or programs. They are about people, right? Tom mentioned this is ultimately about the person. So if we approach each person as an individual and we meet them where they are, we can collectively work towards goals the individual wants to achieve, which promotes better personal investment in stabilizing outcomes. But this means that we have to be dynamic in our approach and really willing to adapt based upon what the participant needs. So the question I like to ask is, what are this person's goals for housing, and how can we support the individual through our program to resolve their housing crisis and work towards stability, right, based upon their needs and desires? And then, of course, let's talk once more about being equitable. We are inherently biased, and the systems we work in are built within a biased and structurally racist system. We know this, right? We've talked about this. It is an ongoing and long-standing issue. So we have to help our participants, the people that we are working with, navigate the systems so that the systems can work for them going forward. So when we think about using an equitable lens, I want to acknowledge the bias within ourselves as case managers, as people who are engaged in interventions, and the system, and that we need to actively work to counter the impacts of that bias. This does not mean that we are treating everyone equally, but instead we are addressing the imbalances within the system to ensure equitable outcomes. So again, the question that I tend to ask myself in this particular situation is, if we know our system is biased and we are looking at structural barriers that impact the individual that we're working with, their housing crisis, what can we do, number one, to immediately help the individual? And then two, in the long term, adjust the system so that this does not happen to people going forward, right? This goes back to the advocacy piece. This goes back to the social justice piece that Tom and Maite were talking about. So let's dive a little bit more into the principles of a strengths-based practice. There's 6 principles here, and these provide a philosophical base as well as day-to-day guidance for the tasks and goals that we are working with the individuals that we are serving. So principle 1, believing in and supporting the people to recover, reclaim, and transform their lives. The strengths model really emphasizes that the capacity for growth and recovery already exists within the individual and the family. This really honors resiliency, as I mentioned on the previous slide, of each individual to continue building or rebuilding a life despite the circumstances that they find themselves in. Recovery is about an individual's ability to recover their sense of self, their identity, their hopes and dreams, and recognize and leverage the capabilities and strengths that they possess to achieve desired life goals and the roles that they want to have. So our job as the helping professional is to help create the conditions in which that growth and that recovery are most likely to occur. Focusing on individual strengths rather than deficits, the strengths model and the practitioner within this model validates that the person's experiences and we respond to those experiences and the immediate challenges that the individual faces. People tend to flourish when we talk about interests, aspirations, and strengths rather than focusing on deficits. It doesn't mean that we're ignoring the problems or the situation that exist, but it really calls on us to push further to really think about the strengths and capabilities that the individual has that helps that person build or rebuild the life that they desire. Number 3, focusing on the community as an oasis of resources, right? This is really not only the strengths of the individual, but about the strengths of the environment. We have to find pockets of strength within the communities, whether that's employers, property managers, neighbors, family, friends, and other community members who can be mobilized to help the individual achieve specific goals. While the community can contribute not only to circumstances, it also provides the opportunity and the resources that people need to thrive. And we need to think about the reality that the primary work and the setting of our work is in the community. It's not within a vacuum, right? So the individual has to be able to thrive within the community. And so we have to think about how they can connect with the supports and the people within the community to allow that to happen and to flourish. Again, going back to participants being the directors of the helping process. We can, of course, bring the knowledge, we can bring strategies, we can bring resources, but this is ultimately about the person and what they want and what they desire. So we are always looking for ways to reinforce opportunities for that person to have control and be the director in their lives, and to really promote the ability for self-autonomy and to work towards having that space to be more autonomous and to be the director of what they want to see for themselves, not only for that moment, but in the future. And then lastly, but really most important, right? We talk about this all the time. It's about the relationship. It is about us having communication and nurturing a relationship with the individual that we are serving. It's really essential to the helping relationship, and it helps build trust in order for us to provide the resources and support that an individual needs to be successful. Without really focusing on the trust, we're never going to get to a place where the individual has enough investment in our relationship to know how much we can offer and to assist going forward. But of course, this is all based on what the individual wants and needs and desires. So I'm going to turn it back over to Tom, who's going to dive deeper into trauma-informed care and the impact of trauma.
Great, thanks, Ashley. Can you guys hear me okay? Okay, wonderful.
Yep.
So trauma-informed care, we are really just scratching the surface. And I know we keep saying that. This is a primer, right? We're just covering some of the core elements, features, principles of housing-focused case management, one of which is trauma-informed care. There are some other, maybe one of my colleagues can drop a link in the chat here. There are other trainings that ICF has offered around trauma-informed care. We're not trying to go deep here, but we wanted to make sure we're centering our work around trauma-informed practices. This is really important. Any case manager, anybody working in the field of human services, supporting people in crisis has an obligation really to know about trauma-informed approaches and theory and practices and so forth. So we're just going to touch on it, right? And trauma-informed care is really about an organizational structure. It's a framework for providing services and treatment that involves our understanding and recognizing and being able to respond effectively to the impact that trauma causes on people, whether it's their physiological, arousal, their emotional conditions, their cognition, their memory. Trauma has lots of physiological, emotional, and other impact on people. And we need to know like how that affects the individual's ability to sort of manage in the moment, to take care of themselves, maybe to take care of their family, and to think clearly about next steps, right? We're going to talk about this in a moment. Why do we utilize a trauma-informed approach? Just to state the obvious, homelessness is inherently traumatic. And I say this a lot when I meet with folks to do training. The person or the family or the people that we're working with may not be acting like they're in a state of crisis. They may not be acting like the housing conditions they're living in are causing them direct trauma. But in fact, it is a crisis, it is traumatic, and it is harmful. It's inherently all those things. And so we have an obligation to, even if somebody's at the moment seems not freaked out about their situation and maybe even somewhat accustomed to it. This is the thing that rubs me wrong in so many ways when I see our colleagues in the field who have just grown complacent because the people we're working with might have gotten comfortable out there in the tent at the camp because they just had to make do. And so they're not going anywhere in a hurry. Does that mean we don't treat it with a sense of urgency? No, we absolutely do treat it with a sense of urgency because that person living out in the woods or staying in a congregate shelter with 50 other guys in the room is experiencing a form of trauma and stress on that spectrum, from light stress to heavy and significant trauma. Let's go to the next slide. I just want to explain why this is important. Again, there's a lot of research that has shown the effect of chronic and prolonged stress, which again is on the spectrum of trauma, right? We think about like chronic and prolonged stress and the impact of that on your cognitive and specifically your executive functioning. It actually retards the dendrils in your brain when scientific, physiological studies have shown retarded brain growth when you're experiencing the ongoing, onslaught of hormones and all the other hyperactive, metabolism that goes on with being stressed out, right? And it literally can cause you, and I mean like we, all human beings, to have less clear thinking. And as Mayte is pointing out, delayed brain growth, right? And like it really does impact you. And why this matters is because when we're doing case management, we're working with somebody, we're sitting at a shelter, and it's 10 in the morning, and they just got out of bed, and they just got their kids cleaned up in the congregate bathroom, and now they're sitting down with you trying to focus on a housing plan. Guess what? That person is stressed out and probably not thinking as clearly as you are. So we need to be cognizant of that. We need to know and sort of appreciate. And there's lots of exercises we won't go into today, but I'm going to give you one more challenge to do before the next session. I want you to take 5 minutes and just sit by yourself for a moment. Think about a time in your life when you underwent perhaps the most critical event you've ever experienced, a death of a family member, a divorce, some other significant loss. Think about how you felt. Think about how you were able to function. Think about what you did. Think about what you couldn't do. And now think about having an experience like that and suddenly having no housing. Or other kind of stress-inducing things, right? So I just want to think about that for a moment and put yourself in the shoes. You think about the client who's sitting across from you who might smell like they just walked out of a bar. And what are the thoughts we're sitting with in that moment? As far as why that person may be actively drinking in the middle of the day. We need to interrogate that thought. I'm not going to go any further than that. I want you to sit with those thoughts. I want you to consider what the impact of stress and trauma is on the people we work with. And does that we have to account for that better in our interactions and how we're working with people and supporting them, and maybe acknowledging that the 5-point, 30 action step housing plan we created with them that they've only done 2 things on isn't so surprising. Because what happens when you're under stress is it feels good to say yes to things that help you move out of the stressful situation. So oftentimes people will be very agreeable to that case plan, and then maybe not be able to follow through as well. And we need to be willing to say, that's okay. Let's just regroup. We need to approach it in that way. That's our obligation. So let's move to the next slide. I want to just say again, and we've sort of talked about this, so I'm not going to go further with this, but there are lots of things that I think we can imagine. Those of you who've been around a minute, you know exactly what I'm talking about as far as the situational kind of stressors that people experience, whether you're sitting in a congregate shelter, you're trying to figure out where you're sleeping night to night, you're staying out in an encampment and you're wondering where you're going to eat tomorrow. All of these things cause a loss of control, it's disempowerment, and people, of course, find control where they can, but ultimately there's a big loss of control, and it creates a sense of survivalist, kind of modality, and people just sort of getting by to get by every day. And we need to sort of recognize the impact that has on one's ability to think about, moving forward to more stable housing. And I'll leave it at this. And I've seen this same attitude sort of play out, particularly for folks who are long-term on the land and they've just figured out how to survive. Is I've seen street outreach folks who have, at the same time, sort of implicitly and sometimes explicitly saying, well, they're okay. They're not interested in housing today. Plus, we don't really know any housing that would work for them. So we're just going to make sure they can live day by day, right? I think that's actually wrong. I think that means we've sort of thrown in the towel on folks, and we haven't really fulfilled our role as a housing-focused case manager. If you're in a street outreach role or working in a shelter setting, as we said earlier, our goal is to resolve the housing crisis. As Ashley pointed out, that's one of our key metrics. We have to keep at it every day and recognize that that person who's grown accustomed to their station at the moment in life is still in crisis, and we should be acting appropriately. So if we go to the next slide, I'm going to just quickly touch on housing first. This is just another approach that's central to our work. I think everyone on the call probably knows what housing first is as a philosophy, but also as a set of practices. It's how we engage people experiencing a housing crisis with the understanding that we should be offering unconditional access to stable housing as quickly as possible with voluntary services that people desire and choose. And that what empirical evidence has shown is when we approach people in a housing crisis with a housing first, kind of voluntary, non-compulsory, using all of our best social work Jedi skills approaches, we actually get better engagement in services and better outcomes. And people report a better experience, right? So housing first isn't just talk, and it's also not housing only. I want to say that's a big misconception. We'll get into that later. We go to the next slide. Just quickly touching on this again, another really big cornerstone of our work is harm reduction. And everything about housing first actually is about harm reduction. And so, again, we're not going to get into it. I would invite you to poke around the website we've offered you here, harmreduction.org. There's a lot of resources out there about harm reduction strategies. And it's important that we recognize that a lot of the folks we're working with may be actively doing things that are harmful to themselves, whether it's using substances or engaging in other behaviors. And we need to meet people where they're at, right? Social work kind of 101 basic approach. Let's meet people where they're at. Let's not expect them to change their behavior before we offer them housing. Like that's just unethical, I would say. People will be better able to move forward in their lives once they're in stable housing. That's what all the evidence shows. So again, we're sort of beating the same drum here, but trauma-informed care, harm reduction, and housing first, very central to our work. So I'm going to move us on here. I know we're running a little bit behind, and I'm going to just quickly say that as Ashley sort of framed it out for us at the beginning of our session, we are going to focus this series in the next 2 sessions on these stages of housing-focused case management in more detail. We're going to talk about crisis stabilization and housing search in the next session. And specifically, how do we assess for housing barriers? How do we assess for other critical needs? What are the very specific things we should be looking for when we're first talking and engaging with somebody? And how do we create a meaningful housing search plan that addresses other critical needs at the same time? That'll be the next session. And then we'll focus in the 3rd session around housing stabilization and retention. One way to think about this too, and then we'll leave it at this, is these are also sort of the points at which, if you're a rapid rehousing case manager, you're starting with somebody while they're literally homeless, and then you're moving them into housing, and then you're providing some aftercare and stabilization supports. What you're seeing on this slide is the life cycle of your job. This is the life cycle of your job with anybody experiencing a housing crisis, moving them from housing crisis to stabilization. And that's why we framed this whole series around this basic kind of model. Now, you might be a shelter case manager, and you might do nothing when somebody gets into housing. So we'll just be aware of that as well. Not everyone has sort of that full scope of responsibilities. But that's good framing for you. I'm going to now pass it back to, I forget who.
Me.
Thank you, Ashley. Back to you.
All right, I'm going to do a little teaser for the next couple of sessions. And just really, we are building upon all of these different components that we've talked about today. So the next session I mentioned is really thinking about that crisis, the intervention and the stabilization piece. So we're going to be really exploring the questions around, are immediate safety and shelter needs met? Are people stable? What are the initial needs to support an individual to secure a unit? And then moving into that permanent housing unit, how are we able to support the participants that we are working with to address the critical immediate needs and also addressing their rehousing needs? And then are we utilizing that strengths-based approach we talked about? Have we made this rehousing plan as individualized and unique as it can be and should be to really support that person in their success? The 3rd session is really going to be looking at that housing stability and retention piece of case management, right? So it provides a natural transition in our case management from that crisis space to the stabilization space. So we're going to be exploring some of the questions around what are the needs that that individual has, and how do we support that individual in their new home, with their new neighbors, with their new housemates, if that's applicable, right? How can we keep that person stable? And then, of course, what are we going to be doing ongoing, or how are we going to be passing this off so that that person has supports to be able to maintain that housing and increase their housing stability? And then, of course, how are we always setting somebody up for success that really builds upon the strengths-based approach? And I will just mention this last thing, and then I'm going to turn it over to my colleague, Erica, who's going to talk about some self-care, is that we've talked about a lot of different components here today. You may be very new in this space. It may seem incredibly overwhelming. Please don't let it be. We have a number of resources that are at the end of this presentation. I would suggest, if you're interested in any particular intervention, to do your own research. There's so much stuff that you can access now on the internet, and we have a few things that we've put in the resources. I would also just put out there, if you're working in a shelter space or some other type of housing intervention, look for the helpers, the case managers who are doing the good work, and learn from them. Ask how they've approached their practice. Ask how they engage in continuing education. That is really a way to, really share knowledge and to learn from your peers and colleagues. So again, we talked about a lot. There's so much here, but this is really for you, if you're new in this space, to be able to create your own particular type of intervention and to have different skills and philosophies that you can draw on to be able to adapt and give the participant that you're working with what they need. All right, Erica, it's turning over to you.
Great, thanks. Lots of information at us today. And if you are feeling fatigued at the end, we get it. But the other thing I want to throw out for you is just knowing that we are, first and foremost, we are all people working in a challenging field. And that challenge can take a toll on you as an individual. Because we've talked a lot about trauma on the folks that we are working with, but recognizing that each of us comes into this with our own life story, and that how that interacts when we're working with folks in some of the most challenging situations of their life can take its own toll. And so you might have heard of compassion fatigue. Some folks call it secondary traumatic stress, vicarious trauma. They're very similar to one another. Ultimately, that's when you've been exposed to someone else's suffering, someone else's challenges, someone else's trauma, and that can cause an impact to your own well-being, your mental health, your physical health, your spiritual health, what have you. And you could start to notice that perhaps you aren't even responding to situations or folks in the way that you were used to. It can make it hard to show up as our best selves in a work that is taking a lot out of you. So meaning perhaps someone could have a shorter temper or a shorter fuse. Things could be more irritable, that could be more tired or lethargic, harder to engage in that way. There could be a lack of emotion, a variety of things within there. And we have more resources. If any of that's ringing a bell for you, or you've seen that impacting colleagues, we have more resources at the end of this to walk through. And there have been some other trainings that ICF has done around this that would recommend that you check out. And assuming we've got a little bit of time, and it's been a while since we've asked y'all to throw something in the chat. So I'm going to ask if you all would humor me and do this third poll. What you see in front of you are just a list of potential options to re-energize and recharge yourself. So if you were able to have, imagine just a day for you, there are no calendar appointments. None of the people in your life are asking anything of you. This is you get to choose your own adventure for what you want to do. Which of these most appeals to you? And if you're looking at the list and you're thinking like, Erica, none of these, like I'd rather do that thing where people like throw the axe against the wall, like put that in the chat. Or maybe there's something else that you would like to do. But just take a minute just to pick, like if you had a day that you were off the grid, what would you choose? And I see folks are selecting it, so thank you for that. Looks like it, oh, sorry, I'm like also the slide master and it's moving forward. Looks like it's slowing down a little bit. So I'm gonna just end the poll. And we've got a group of folks who like to do a variety of things, which I love to see. That could be just like reading a book that you've actually wanted to, be that on like a Kindle or a e-reader or on your nightstand, binging some sort of show or movie with your favorite treats, listening to music or a podcast, sleeping in and not checking my work email all day. Highly recommend that one. I love that one for myself. Watching a sunrise or sunset with a loved one, a variety of things. So Ashley talked about talk to your peers about how you stay engaged in the work. You just did that a little bit, but keep talking to folks because there could be other things out there that you would love to do. And then this last slide here, this is the last of our content, and then we'll move into just sharing the resources, is really all about caring for ourselves. And some of that's on us as individuals, just as we are people on this earth, about how do we keep showing up. I would also say some of this falls on our organizations to make sure that they're checking in, because if we are working with vulnerable populations, there's an onus on organizations to create a culture of support and to make sure that we are checking in with each other, be that your supervisor, peer-to-peer, there are policies in place that if you have time off scheduled, that you're able to take that and able to ideally take that without having to worry about checking email or checking in on things. But you'll see in front of you, some of this is a list that's been developed through SAMHSA as it related to folks who are involved in responding to natural disasters. And then it's been adopted in other communities such as ours, where we're working with vulnerable populations, of ways that we can create rituals or things on a daily basis. So one I would mention, just first and foremost, like if folks are starting to feel run down, to focus on some of those core components of resilience. So make sure you're getting enough sleep, that you're eating things that are going to nourish your body in the way that you need it to, regular physical activity. And that could just be like taking a walk, like whatever that means to you, do that. And then active relaxation. And I think that is, what does it mean to you to relax, and that you're being purposeful about it. But also there are things that folks have done, like washing up after your work shift as a way of like washing away the day. And that could be your hands, it could be your face, you could hop in the shower. My sister's a pediatric nurse, and I know she uses that regularly as a part of her process, just kind of be like, all right, that's closing of that day. But I also think whatever other rituals that allow you to let go of stress, but also rituals to celebrate the good things that happen. We're really quick sometimes. I think I should say I am quick to move past the good, to be like, great, that happened, and then move on. But it's just as important to acknowledge those different wins, small ones to large ones. And I would say there's other things on this list. If there's things that you practice that aren't on here, welcome you to throw that into the chat for your peers. We love to hear from each other of what that does. But I did put in here a quote by Anne Lamott that says, almost everything will work again if you unplug it for a few minutes, including you. Sometimes one of my biggest things of my own care for self is just when the noise from the world gets too loud, turning off my phone for a couple of hours, completely going off the grid. It freaks my family out because they're like, wait, we can't see where you are on Find Friends. That's okay. You don't need to know where I am. I'm probably sitting on my couch. So recommend that too. You're going to get a copy of these slides. So I'm not going to camp out on these, but this trauma-informed care resources goes into a lot of different things that could be useful for you as an individual, for you as a colleague, for your organization. We also have you'll see we hit you hard with some of these trauma-informed care resources. So hopefully there's something here that resonates with you, that if that's an area that you want to explore, or if you're not in that place, great. These are ways to continue to support you showing up in a healthy space at work. Here are some other trauma and stress related resources. And then ultimately, I recognize we did quite a bit of talking at you, but we wanted to create space right now for just questions, answers, and dialogue. So I'm going to stop sharing the screen so we could see each other's faces and just create space for folks to come on camera, come off mute, use the chat, whatever you're most comfortable with.
If I could just say something while people come together, now that we can all see each other on the screen. I wanted to add something connected to this idea of when we're working with clients and finding out where they're at, sort of working with them where they are. I think connected to what Erica was just pointing out about taking care of ourselves so that we can take care of each other or other people. I invite you to think about how you assess where you are, because in order to take care of you, you have to know how to check in with yourself. And I know I've been in a lot of self-care trainings, and sometimes we forget to mention that in order to know what it is you need, you have to know what you need. So it works the same for you as it does for other people. So, as Erica said, questions, thoughts, comments.
Chris's cat is joining us. If you all can see Chris Pitcher's cat, kind of our mascot for today, walking across. That's personally one of my favorite things about Zoom life, are seeing like pets and children that like just show up. I think that's great.
And pets are also very good mood regulators. So if you don't have one, find one, go with a friend, hang out with one.
Well, I know this was just a teaser of what's to come. We have 2 more sessions where, as Ashley and Tom have explained, where we're going to go deeper on different things. Chris, you can't donate your cat to the cause. But so there's more. And I would also encourage some folks, sometimes it's helpful to take a step away from a conversation and process that. If you think of things that you want to go a little deeper on, we encourage you to give that feedback to the ICF team and us, because we can factor that into our planning. The whole purpose of this series together is to make it useful to you and your roles and what's going on in communities right now. And so we welcome you to share feedback. We're open to it. We're even open to you doing like throwing us off course in the middle of a presentation, and we can come together. That's the whole purpose.
Well, and I would just add to the really, like, seriously, guys, if there's something like in the next two sessions, the general kind of focus we'll have for those sessions that you or your team are struggling with, or would love to share, like something you're doing really well. We don't have all the answers here. We're just trying to lead the conversation. I'd love to hear any thoughts. Seriously, we've got a couple minutes. Does anybody have any burning topic around housing? Yeah, go ahead, Samantha.
Yeah, so when we started working together, we all started adding more hats on. We were all peer support specialists, and then we were housing navigators. And then now one of us is going into care management dang near full time. And so one of the beautiful things is we have these well-rounded moments, and we're kind of just learning all the little veins. So the self-care roots itself deeply in how we communicate with every single person that comes into our wellness center. And the housing is kind of just like it feels like, instead of it being like the only job, it feels like a part of the toolkit. So, when we have homeless individuals that come in and they're really friendly, some of them come every single morning like clockwork, and they want their coffee and they want their snack, and we have a tobacco stick, and it's just, some of those folks aren't ready to talk or commit to housing situations, continual documentation, communicating with the CDC, So what I think is actually very, very beautiful is the relationships built through kind of like the, oh, hey, so Josh, what are you going to do? You want to do some paperwork today? And it just feels really, really good knowing that this community is far bigger than we are, because sometimes we just feel so small. And looking at all of your faces, I don't recognize any of you. So it's nice to know that you all exist out there doing stuff. And yeah, these are going to be fun sessions. So that's
Great.
just kind of where I'm at right now.
Thanks for sharing that.
Yeah.
Anybody else have any other and thanks, Samantha. I think I regrettably will not be in the next session. I'm going to be traveling. I'll be in the third session. But I think let's bring it back to this. How do we, I love your point about like our work is kind of centered around our own self-care. Housing is one. I mean, I want to say this before we chime off. We're calling this housing focused case management. Just like housing first isn't housing only, housing focused case management isn't housing only focused case management, right? It's just about like where we sit. And we didn't talk about this, so I hope you all can get into it a little bit next time. I'll be sure to pick it up in the third session. This idea of a responsible party, we didn't touch on. But, as a housing focused case manager, no matter where you sit in the system, systems are starting to evolve to this concept of let's make sure to the person, to the family, everybody has a reliable, responsible housing focused specialist who's going to help them with their housing needs while they're working through the housing crisis. That's what housing focused case manager role is fundamentally. Sometimes it's very narrow. Sometimes it's very, you're kind of working through that whole life cycle. But sometimes maybe housing is just a piece of your overall role. So Samantha, like you're saying, if you're a community health worker, you've got 7 other domains to pay attention to equally, right? So I think we should come back to that. I love the fact you brought that up, but thank you. And then I will see you all in 2 sessions, but Erica, Chris, any sign off? Sorry.
Yeah, thanks, Tom. Want to thank our presenters today, Tom, Erica, Ashley, Maite, and our folks behind the scenes, Kristen and Taylor. And thank you all for joining us for this California Housing and Community Development Committee Workshop session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services Contract. Look out for more information on our upcoming community workshop sessions, including the 2 others in this series. A 3-question survey will pop up as this session ends. Please provide feedback. We look at it every single week and we adjust, we adapt to what it is that you're telling us. So please do take just a few minutes to fill out that survey. We hope to see you next time. Until then, be well.